Dr. Ezi, and I'm a member of the Royal College of Surgeons, Edinburgh. And this channel is made for you to be able to pass the MRCS Part B OSCE. Okay. So these lectures do not come regularly. They may come after 1 day, after 1 week. So you can subscribe to the channel and you can make the bell on so that you can get the new updates. Okay, so let us continue in the critical care stations. Okay, and actually we already started the acute pancreatitis, right? Pancreatitis. So we finished 2 sections, and here we are going to go to the next question that will show up by the examiner. He's going to ask you about some scoring systems for acute pancreatitis. Okay, and he may ask you directly about Glasgow criteria. Okay, and before we go to the details of this, you want to know that systems do 3 things. Okay, number 1, they tell you about the severity of the attack. Okay, number 2, they tell you about the prognosis of the patient and of the sickness, and number 3, they give you an idea about the morbidity. Okay, so you want to know why they are making these criteria. So let us go to the Glasgow criteria for acute pancreatitis. Okay, they are concluded in the word pancreas, and that is why this is one of the easiest systems to remember, because there are abbreviations, and we are going to try to relate it to the letters of the word. Okay, so Glasgow criteria number 1, we will take the P, and the P is an abbreviation, or considered like that, just to make it easy for you to remember. It is related to PaO2, and we have hypoxemia in this sickness, in acute pancreatitis. So it will be less than 8. PaO2, partial pressure of oxygen, will be less than 8 kPa. Okay, this is number 1. While A is related to the age. Okay, and if the patient's age is more than 55, that is not good. Okay, well, number 3, the N is related to the neutrophils, and actually it is related to the WBCs in general. Okay, to the white blood cells, they are considering the neutrophils, but you want to remember the WBCs by that. And if they are more than 15,000 or 15K, these are bad news. Okay, let us go to the C now in pancreas, and C is related to the calcium. Okay, calcium will be less than 2 millimole per liter. Okay, so let us go to the R. R is related to the renal system, and here we are considering the urea, and the urea will be high. Okay, if it is more than 16, this is a bad indicator, or the prognosis is not good. So now E is for the enzymes. Okay, and the enzyme which is considered in the Glasgow criteria is the LDH. Okay, and it will be high, it will be more than 600. If it is more than 600, that will not be good. Okay, and let us go to the A of the pancreas. This is related to the albumin, and let me tell you something here. If the albumin is low in any severe sickness, this is a very bad prognostic indicator. it will be, according to the Americans, less than 3, or in this case here it will be less than 32 gram per liter. Okay, and finally we will go to the S, and S, as you know, is related to the sugar or glucose. Okay, and glucose will be high here. It may be more than 10 millimole per liter, and this means that there is a true damage to the beta cells of the pancreas. So these are the Glasgow criteria. Well, I think that is clear. We will go to the next question now, and the examiner is going to ask you the next question here, and he will ask you that do you know any other scoring systems? Okay, and you are going to tell yes. So you'll ask you mention some Ransom's system, Apache 2 system, Balthazar CT scoring system. These are 2. These are enough. There are many actually, but you can't remember these 2. He will know that you know already. Okay. The next question he is going to ask you, please pick one and tell me about it. So I advise you to pick the Ransom criteria. Okay. So Ransom's criteria are easy because they are related to the Glasgow criteria, and the Glasgow criteria can be remembered by the abbreviation of pancreas, right? So the good of this system is that it takes the score on admission, okay, and it takes it also and it takes it on or after 48 hours of admission. This is the good about it. Okay.